agreeing at different positions. I think it's something I've lost. I want to go back. I want you to look at these molecules. Just give me one minute as you look at these molecules. I want to look at you to look at those structures. So I wanted you to look at those structures to see their similarities and differences. So we are saying, of course, this is the huge molecule. It looks a very huge molecule. It's a macromolecule, but even as it's a macromolecule, the areas that are allowed for structural modification, very minimal. Otherwise, the rest of the molecule is needed if this drug, if the rifamycin is going to bind its respective receptor within the tubercle. So rifamycin SV, and for rifamycin SV, R is a hydroxyl group. So if R is a hydroxyl group, that means that's a hydrogen. So R is what you have, a hydroxyl group, and then you can also see position 1 also. In this ones, we have position 1 for all of them, the ones here, position 1 is a hydroxyl group. You see that you can also change the group at that position. So rifamycin, that is a hydroxyl group. Rifamycin B, this is a glycolic moiety, OCH2COH, at that position again R, and this is a hydroxyl group. R1 is still a hydrogen. Rifamycin L, that one we will not deal with it. That one also. So the most important here are rifamycin SV and rifamycin B. Those are the ones we will really come across. Then we have the other type of rifamycin, like rifamycin S. You find for rifamycin S, that group there at that group there. So here for these other rifamycins, it is where the X and the R can change. That means this position here, all the groups are the same at that particular position. So if you look at rifamycin S, then the R is a ketone. Sorry, not a ketone. Yeah, it's a ketone. It's an oxo group. So the RX, I must know what is X. Yeah. Oh, I had covered one, sorry. So yes, and so for rifamycin SV, sorry about that. That is showing that one was okay. And hydroxyl group, that is a hydrogen. For rifamycin B, the same. Glycolic moiety hapo, still a hydrogen. The others we did not deal with. Now, when we come to rifamycin S, where I realize there must be a problem, then the R here is a carbonyl group. And like, see here, it was a hydroxyl group. So when you come to rifamycin S, that is an oxo or carbonyl group. And here X is also a carbonyl group. So you have double bond O, and of course that's a quinone. So that's double bond O, quinolone, another quinolone, double bond O, that's the rifamycin S. And then the rifamycin O, the R here, it's a little bit more complex. You can see it here. It is actually this moiety. I believe it's this moiety, the O, CH2, C double bond O. So this moiety in rifamycin B, the moiety that is found in rifamycin B at this position here. So it comes there, oxygen, and the same position. So it forms a cyclic ring. The moiety that is found in rifamycin B, for rifamycin O, it forms a cyclic ring. So you have another extra ring there. So that is that ring there. So this is the moiety, this moiety. It undergoes cyclization to give us this moiety at that position. Our X is still a carbonyl group. We are not going to deal with rifamycin D. So those are some of the naturally occurring rifamycins, A, B, and we have looked at S and oxygen. Sorry, SV, B, S, and O. We also see the others as we go along. So you can see you can have when this group here is a quinone, and you can have it when it's a phenyl group. Of course, when it's a quinolone, then when it's a quinolone, then you have a double bond there, and of course, when it is a normal phenyl ring, is when you have that as a hydroxyl group. So again, these are the naturally occurring rifamycins, which we have also said did not really have the activity that we want. They had to be structurally modified. They were structurally modified to give us the kind of activity that we require for good therapeutic indications. For them to be used as drugs, they had to be structurally modified so that give us the activity, the minimal toxicity, long enough duration, and of course broad spectrum. Never forget that especially for the antimicrobial agents, one of the reasons we do structural modifications is to get molecules that have a broader spectrum of activity, because that is very, very, very important. Again, reduce that and then make it big. This we had looked at. So that slide we have. I just wanted us to appreciate the different rifamycin. So we are saying they can be classified into natural and semi-synthetic. Natural rifamycins include A, B, C, D, and D, which constitute the rifamycin complex. They all occur as a mixture. Semi-synthetic, we have rifampicin, rifamide, rifampicin, rifabutine, and rifalazine. So we will look at their structures, and we will be able to appreciate the structural modifications that have been done with the natural occurring to get the semi-synthetic, and with a reason. Any structural modification was done with a reason. Only rifamycin B was isolated as a crystalline pure substance, that is, of the naturally occurring. Only rifamycin B was isolated as a crystalline pure substance, and this was done as when it was produced from the rifamycin complex by addition of sodium diethyl barbitурate. So when the sodium diethyl barbitурate was added to the fermentation media, rifamycin B was produced as a crystalline substance, or isolated as a crystalline pure substance by addition of sodium diethyl barbitурate. Rifamycin B has the unusual property that it is in aqueous, oxygenated solution, it tends to change spontaneously. So again, very, very unstable. Just as we were looking at the prostaglandins, these very unstable molecules will undergo very rapid spontaneous change into other products with higher antibacterial activity. At least that's the advantage. There was rifamycin O, whose structure we have looked at, and rifamycin S. Rifamycin S we obtained by mild reduction from rifamycin S, was the first member of the rifamycin family to be used clinically. And of course, we did say it still had a disadvantage in that it could only be used intravenously. So we are saying that again, these are molecules that are unstable, they undergo several spontaneous changes, and therefore, again, because of that instability, again, need for structural modification to give us a molecule that has stability. So when we look at this structure now, as I said, this part of the molecule does not change, and we're going to discuss it when we're looking at the SAR. But we are saying for rifamycin B, it has, I thought rifamycin B, we said this was a hydroxyl group. Is that correct? And then rifamycin SV, like just 1 minute, I see whether that is correct. Rifamycin B, okay. Let's see what we gave as a structure. I don't want us to confuse. Rifamycin B, yeah, it's correct. Yeah, it's the one, rifamycin B, I wanted to confirm that. It's the one which has the glycolic moiety. So for rifamycin B, so these are the structures now. So for rifamycin B, this is the group you're saying CH2COOH, and that's what we did mention, that this group somehow is remember this C double bond O minus. Remember, this group is ionized. This group is ionized at physiological pH, and because it is ionized at physiological pH, it will form an anion. Again, look at this carbon joined to an oxygen, and because the carbon is joined to an oxygen, this carbon has a delta negative, so the anion can attack this position here. And when that happens, then that is how we are getting our rifamycin, the rifamycin O, where this attacks there, and we get that other rifamycin. So that is our rifamycin B, and with that group there is a hydroxyl group. These are rifamycin S, and for our rifamycin SV, it is simply hydrolysis product. So the rifamycin B undergoes spontaneous oxidation and hydrolysis to give us our rifamycin SV. Again of importance to note, of course, that position is the same. And of course, the areas, we will see that the areas, again, we have already said, which could have changes are this area, that area, and that area. And of course, this usually we call it position number 1, That is position number 2, position number 3, position number 4. We skip the intersection. Position number 5, position number 6, position number 7, position number 8, where you have the hydroxyl group, position number 10, position number 9, position number 10. So this molecule here, the naphthyl group, or the naphthyl moiety, or the aromatic area, is the one which is numbered first. Of course, normally we avoid the intersection. We number that section, and then we continue the numbering. So it was good to draw those structures so that we appreciate the different types of the rifamycins. Yeah. Has the internet disappeared or what? Okay, there we are. We are trying to see again the conversion of rifamycin to the other. So again, we are saying we are starting, that is our rifamycin B. We said it was the first one to be isolated as a pure crystalline compound on addition of sodium biturate. And you can see that you have a hydroxyl group there. You have this moiety here, which is actually an oxoacetic acid. You can see that's oxoacetic acid. You have that group there. And this, as I said, we understand this carbon here is negative because of that, and this can form an anion, and that's what we said. This anion can attack that carbon, and that's how we get our rifamycin O, and nothing else changes. Everything, of course, a rifamycin O, if that attacks this, of course, the double bond cannot exist. That double bond cannot exist. It will shift there, and once it shifts there, this double bond cannot exist. And therefore, if this double bond cannot exist, then this carbon will not be satisfied with the hydroxyl group. It changes to a double bond. So that's all that happens. You attack that carbon has too many substituents, that bond shifts from there to that position. And once that happens, then this carbon has too many bonds, and therefore these electrons shift to form a double bond between the oxygen and the carbon. So that is our rifamycin O. So our rifamycin O has an oxo group at position number 1, 1, 2, 3, 4, and at position number 4, it has a cyclic. It has a cyclic ether. It has a cyclic ether at that particular position. Then from there, we go to rifamycin S, and if you look at rifamycin S, again, the rifamycin S will lose. So you see, it's losing the CH2COOH. So it loses this group here as rifamycin S. That group is, and of course, it's losing it from here. This is rifamycin O. So it loses the group CH2OH, CH. This becomes a COH, and of course, CH2OH. And of course, it's in aqueous media, so it forms another oxo group there. So oxo group there, and that is our rifamycin S. Again, these are spontaneous changes. So from rifamycin B to rifamycin O to rifamycin S, and then finally to a rifamycin SV. And rifamycin SV, you can see, is just a reduction. Rifamycin S and a Gauss reduction again to give us a rifamycin V. And we have said rifamycin SV is the first rifamycin which was found to have significant or reasonable pharmacological activity to be used clinically, although we have said it is actually used intravenously, but we can be able to see the conversion of rifamycin B through rifamycin O to rifamycin S, and finally to rifamycin SV. I did mention some of the semi-synthetic rifamycins. All of them are still rifamycins. We did mention some of them are naturally occurring, Others are semi-synthetic. Of course, the need for the semi-synthetic is to introduce groups that gives you the characteristics that you'd want. And definitely you can see when you look at, again, our positions mainly for change are these positions. You can see this position as a huge group which has been substituted at position number 3. Again, you see the same there. Again, you see the same there. This position 3 and 4 here. Again, a major structural modification at position 3, 4. Again, major structural modification at position number 3, 4 to give us a different drug. So all we are trying to say is that for the rifamycins, the ones that we are having as the current drugs in the market, the main change is at position 3, 4. Main change is at position 3, 4 because we realized the naturally occurring rifamycins can have a hydroxyl group at position 1, or an oxo group or a carbonyl group at position number 1. So that's not a major change. But when you look at the substituents at position number 3, 4, that is where the major structural change occurs. If you look at all the other groups within the rifamycin, the rifamycin moiety, the larger portion of the rifamycin, you see it is intact for it to have pharmacological activity. It cannot be changed. If you change it, then you also have another one of rifaximin. Again, the only reason why I've shown you the different groups is just to appreciate that the main area of structural modification is at position 3, 4, but the larger portion of the rifamycin is left intact. It's left intact and without any change. This CPA, we have said, under special fermentation conditions, that is where we are putting diethyl acid. The main product you get is rifamycin B, which we are still considering to be a product of the fermentation. Structure, the rifamycin consists of the naphthoquinone, or naphthoquinonic chromophore, from the word naphthoquinone. Naphthoquinonic chromophore. In other words, this area must be left intact. That's why we are calling it the chromophore. But it's not the only area. We have seen even the bigger portion of the aliphatic side chain also must remain intact for activity. So the rifamycins have a larger, huge area which represents the chromophore, both the side chain and the quinone, which requires to remain intact for activity. So structure, the rifamycin consists of naphthoquinone chromophore, which is spanned by an aliphatic answer chain between the nitrogen on carbon 2 and the oxygen on carbon 12 of the chromophoric moiety. So we are saying, I had already explained what is this answer. It's where you have that aliphatic side chain joining, and this one is joining position number 2 and position number 12 to give us the rifamycin derivatives. And you can see that joining does not change also. It is constant. Rifamycin SV is the only one which is used parenterally for management of TB. Chemical modification of the natural molecule, that's rifamycin B, and of its derivatives has resulted in synthesis of biologically active rifamycin. Condensation at carbon 4 of the chromophoric group with an aromatic amines, hydrazides, aminohydrazones, and aminoguanidine was quite. In other words, it was a rigorous process. It was a rigorous process. Sometimes what you do random screening, whereby you are adding different groups, just adding different groups because you do not know which group will bring good activity. They kept adding different groups, changing those groups until they got good groups found in rifampicin with good, very high antituberculous or antitubercle activity.